Welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. So for the record, please note that Erin Kelly is representing Deputy Mayor Ann Williams Ison. Karen St. Hilaire is representing Molly Wasso Park. And Dr. Fatima Shamani is representing Dr. Michelle Morse, all in a voting capacity. So next on the agenda is the adoption of the minutes for the Board of Directors meeting held on October 31st, 2024. Are there any questions or comments on that? Can I hear a motion to accept the minutes?
So move.
All in favor, please say yes.
Yes.
Opposed, say no. The motion carries. So during the executive session, the board received and approved oral and written governing body submission from NYC H&H Harlem. The board also received and approved the semi-annual governing body written submission from NYC Health and Hospitals Jacobi, North Central Bronx. So let me move on to Vendex approvals. Since we began the process of approving contracts prior to Vendex approval, there are 16 items on today's agenda requiring Vendex approval, of which eight have that approval. There are 31 items from previous board meetings pending Vendex approval. So we will continue to notify the board as outstanding Vendex approvals are received. So let's move on to the resolutions next. So item number 6 in the agenda, Dr. Cormier.
Thank you. Authorizing New York City Health and Hospitals Corporation, the system, to execute a best interest renewal with Physicians Affiliate Group of New York, PC, for physical and behavioral health services at correctional health facilities for a not to exceed amount of $622,600,000 for a contract term of 3 years and 3 one-year renewal options at the discretion of the system. This was presented to Medical and Professional Affairs Information Technology Committee on November 4th for presentation to the full board.
Thank you.
Great, thank you. I'm Tim O'Leary. I'm the Chief Financial Officer for CHS, and you know Patsy Yang, SVP. Some background for you here. CHS was established as a division within New York City Health and Hospitals in August 2015. A primary impetus was to improve the quality of care by directly providing services rather than through the contractor. To support this goal, all management and supervisory staff, as well as many frontline staff, are direct health and hospitals employees. However, some of the frontline staff whom CHS selected to retain were employed by the contractor. To avoid disruptions in patient care, it was important to preserve the benefits of these employees. CHS therefore selected PAGNI to employ these individuals. CHS staff employed by PAGNI are strictly frontline patient care personnel in medicine, mental health, and social work, and are members of Local 1199 and Doctors Council. PAGNI staff comprise about a third of the CHS workforce. CHS's contract with PAGNI is limited in scope and ensures a high level of transparency and accountability. The PAGNI contract for CHS is limited to personnel and payroll services only. The staffing plan is established, reviewed, and finalized by CHS. We maintain a close relationship with PAGNI for all human resource and labor relations actions, policies, and procedures involving CHS staff. And CHS establishes an annual budget for PAGNI consisting of payroll expenses as well as allowable overhead and admin costs, which have been capped at 2.75% since inception. CHS receives and reviews biweekly payrolls from PAGNI and their financial expenditure reports. The contract expires at the end of this calendar year, and there are no more renewal options. H&H and PAGNI entered into a contract for an original 3-year term starting at the beginning of 2016 and ending at the end of 2018, with an option to renew for three times for successive 2-year terms. And we've exercised all of those renewal options at this point. New York City Health and Hospitals reimburses PAGNI for their financial outlay for authorized expenses. PAGNI expenses are shown here, ranging from $85 million to $97 million annually over the last 5 years. CHS regularly audits and reconciles payments to PAGNI as part of our ongoing financial review of its expenses, and all of CHS's operating costs are fully reimbursed by the city. Under Operating Procedure 100-05, the system can renew a contract with appropriate vendor and pricing due diligence rather than reprocure when it's in the system's best interest to do so. It is in the best interest of CHS to continue with the current arrangement. To repeat, the renewal will ensure a continuation of services for CHS patients. CHS's contract with PAGNI is limited in scope, and the admin costs have been capped at 2.75% since inception. Here's the vendor performance evaluation. We rated them satisfactory. And pursuant to the vendor diversity policy, clinical services such as these are exempt from the vendor diversity program. And here's the authorization. Shall I read it?
It's okay. Any questions from board members? Okay, so all in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much.
Yep, thanks.
So let's move to from number 7 through 14, Dr. Calamia.
Thank you. Yeah, we're going to be consolidating the next 8 resolutions. They're basically all related to approval of American College of Surgeons. Actually, I'll read it. It's approving the application of New York City Health and Hospitals Corporation for verification by the American College of Surgeons of the New York City Health and Hospitals centers that will be listed below. There are 8 separate ones. We will be committing to maintain the high standards needed to provide optimal care of all trauma patients, but the Multidisciplinary Trauma Performance Improvement Program has the authority to evaluate care across disciplines, identify opportunities for improvement, and implement corrective actions, and also authorizing the appropriate offices of the system to execute any and all documents necessary to verify through the ACS, American College of Surgeons Committee on Trauma. And this will be for level 1 adult trauma. That'll be including Bellevue, Elmhurst, Jacoby, Kings County, and Lincoln. At level 2 adult trauma, that will be for Harlem Hospital. And lastly, level 2 pediatric trauma will be for Bellevue and Jacoby. So we'll have one presentation and we'll have discussion related to any of the individual ones as well. But
thank you, Dr. Calamia. Good morning. Good afternoon, Dr. Khan, Dr. Katz, board members. I've been asked to be brief. These are the trauma centers that New York City Health and Hospitals runs and operates that Dr. Calamia mentioned. These are the ones that we're voting on resolutions for today. Next slide, please. So this book is the de facto regulatory book from the American College of Surgeons that outlines all the rules and regulations that our verified trauma centers must follow. The book was put into play about 2 years ago. It's a very rigorous process. The College of Surgeons comes and reviews all of these rules at all of our trauma centers every 3 years. Next slide, please. So the book is accepted by reference in the 408 health codes for the New York State Department of Health. That is to say, the American College of Surgeons verifies that the rules are followed, and then essentially the Department of Health rubber stamps that the rules have been followed, and then they declare that, designate the trauma center. Next slide, please. And this is just to say that there was a slight rule change in this book that required us to say the exact level, as Dr. Calamia helped us with, of what the trauma center is. So pediatric level 2, adult level 1. That was a rule change. That's why we're back here so soon asking the board's indulgence to pass these resolutions. Next slide, please. So in brief, so trauma centers are complex places, lots of moving parts, very sick patients. New York City, a lot of penetrating trauma. There's a lot of complexity to taking care of the injured patient. So research and scholarly activities, educational, profession, community outreach, things like Stop the Bleed. And then Dr. Calamia read so beautifully the importance of performance improvement. So the American College of Surgeons recognizes that trauma surgery is an art and a science, that occasionally there are goofs or glitches. Let's say the word glitches. They expect us to look carefully at those glitches and do better the next time. That's why we asked the board to authorize the performance improvement program across the enterprise. And then all the myriad widgets, doodads, and facilities. You got to have an operating room available right away, lots and lots of blood, radiology, and all kinds of specialty equipment for a trauma center. So I really think, I'd like to say that New York City is blessed by New York City Health and Hospitals. I don't mean bragging for us. The care, even though we're a safety net hospital, the care that we deliver most of the time is second to none. I would be taken care of, a family member would be privileged to be taken care of in any one of our trauma centers. And I thank you, Dr. Katz, and the board for continuing to support our trauma centers.
Okay, any questions from board members? Rita?
Could you just explain how we determine which of our hospitals are, level 1 and which are level 2?
Dr. Katz, should I?
Please?
So, first of all, we believe that, and Dr. Katz and Dr. Allen and others have looked at this, we believe that New York City is very well covered. If you are an injured human, you will get to a trauma center, a verified American College of Surgeons trauma center within 8 minutes. So, and Dr. Katz always speaks to us about balance, right? We can't do everything. Now, the difference between a level 1 and a level 2 trauma center, clinically, according to the American College of Surgeons, is very, very similar. There, if you note, most of these things say all levels. So the care in Harlem, which is a level 2, should be pretty much as good. The difference is things like research and community outreach. And then the other thing about level 2 versus level 1 peds. So for level 1 peds, you have to have hundreds and hundreds of injured kids. And thank God, for example, in the Bronx, we're the only pediatric trauma center in the Bronx. We don't have hundreds and hundreds of badly injured kids. We have 100. So we think that we have pegged the resources exactly where we need to be, and all over New York City, trauma center coverage is good. That's what we think.
And do we change over time? Like, will we look and see if the needs are changing, or has Bellevue and Jacoby and they've always been the same level?
It's not certainly, Shell is one of our great experts. It's not easy to create a trauma center.
Okay.
Right. Requires huge investments and reviews. You may know that we've been discussing whether or not there will need to be a trauma center in the Rockaways because of the increase in population and the geographic isolation of that area, where by typical numbers, the numbers of severely injured people are not so great, but the travel times are extraordinary. In the case of the police officer, where it took for a police officer who was shot more than 40 minutes to get to Jamaica Hospital with police escort. Right, so you can imagine, right, what it would normally take. Has raised the question of, do the Rockaways need a trauma center? The whole state of Montana doesn't have any trauma centers. They use the trauma centers in the surrounding states. So there are sort of minimum qualifications, but there's no sort of exact science of, this equals a trauma center, this doesn't. We're very proud of our trauma centers, and I know Jackie talked at a previous meeting about the tremendous success that Harlem had with that young girl, and that's something we can all be very proud of for the trauma centers. We don't have any immediate plans to create additional trauma centers, with the exception of Rockaway, where it may not be us. Right now we're engaged in the public discourse about whether there needs to be one, not necessarily that Health and Hospitals would be the operator of one.
Thank you.
Other questions, or? Okay, so let me then, let me see here. So all in favor of approving the applications for verification by the American College of Surgeons for Level 1 adult trauma for Bellevue, Elmhurst, Jacoby, Kings County, and Lincoln. Level 2 adult trauma for Harlem, and Level 2 pediatric trauma for Bellevue and Jacoby. All in favor, please say yes.
Yes.
Opposed, say no. So the resolution 7 to 14 are approved. Thank you so much, Mr. Pepperman.
Thank you, Dr. Tepper.
Let me move to number 15, which is authorizing New York City Health and Hospitals Corporation, the system, to execute a revocable license agreement with Bellevue Daycare Center, Inc. for approximately 3,661 square feet on the first floor of NYC H&H Bellevue. and the use of the outdoor playground within Bellevue's First Avenue Garden, in which to operate a licensed childcare center for Bellevue staff and the community for a term of 5 years, occupancy fee waived. This was presented to the Capital Committee on November 4th, 2024.
Hi, good afternoon. I'm Melissa Brody. I'm here on behalf of Bellevue's Chief Operating Officer, Marcia Peters, who apologizes she was not able to attend today. I'm here with Loyora and Deborah, and we'd like to begin today by providing some context why the daycare center is so valuable to Bellevue and the community. Access to affordable childcare has been recognized as a national challenge. The Surgeon General recently issued an advisory that there's an urgent need to support parents and to support caregivers. According to a study from the White House, the rising cost of childcare has outpaced inflation, with low-income families burdened the most. On average, low-income families spend a third of their income just towards childcare. And hospitals like Bellevue have recognized that childcare benefits are great for recruiting staff and also for staff wellness. Next slide, please. The Bellevue Daycare was established almost 50 years ago. It was originally located in the basement of a building on Bellevue's campus. The daycare is there. It provides access to quality childcare for working families in Kips Bay that is a high-cost area. These working families are able to uniquely benefit from having the daycare as an option for affordable childcare. The daycare is located on Bellevue's campus, and it's ultimately convenient for Bellevue staff doing drop-off and pickup for their children. Next slide, please. The Bellevue Daycare currently offers 33 childcare spots. It's able to prioritize Bellevue staff to target at least 51% enrollment for the infant and toddler program. The daycare center is regulated by the Department of Health and the Department of Education, with the Department of Education managing the 3K and pre-K preschool programs. Next slide, please. Now we'll turn to the tuition figures. Tuition for the community is 25% below market rate for Kips Bay. The daycare offers a further discounted rate for Bellevue staff, and they're there to assist with financial assistance, such as vouchers and subsidies. They're really the experts in helping everyone apply for these programs, and last year we had some families who have staff at Bellevue that paid under $100 a month for childcare services. Next slide, please.
This is the space and planned expansion space. The Bellevue Daycare Center currently occupies 3,031 square feet in buildings C and D. Expansion by 630 square feet on the first floor of the administration building next to the Bellevue Chapels to add a multi-purpose space and another classroom adjacent to the existing location. The existing space and expansion space are not readily convertible into patient care space, and the cost of construction will be funded by a grant from the New York City Council to the Bellevue Daycare Center. The Bellevue Daycare Center will have 4 classrooms with space to operate 4 programs: infant, toddler, 3K, and pre-K, and enrollment slots are expected to grow from 33 to 42 spaces. The Bellevue Daycare Center has exclusive access to the outdoor playground within Bellevue's First Avenue Garden. Next slide, please. These are the terms of the license, which are 5 years terminable by either party with 30 days notice without cost. The location is 3,661 square feet on the first floor of the administration C&D building in New York City Health and Hospitals Bellevue, and the use of the outdoor playground within the First Avenue Garden. The hours of operation will be 8 a.m. to 5:45 p.m., and the occupancy fee is waived for the benefit conferred by staff having access to affordable, convenient, and discounted childcare with a prioritization of staff to fill at least 51% of the infant and toddler program slots. Resolution for your approval.
Thank you so much. Any questions, Dr. Calamia?
Yeah, so just I'm trying to get a sense of what the needs of the staff are and what the capacity, in comparison to the capacity, even though I know you're expanding it. And because is that 51%, is that a minimum or is that a limit? So in other words, are there staff that are turned down on behalf of community people who would like to take advantage of the program?
The 51% is a minimum. There have been times in the past where it's been above that 51%. I don't have the exact figures on whether there have been staff that have been turned around, but if you're able to get on that wait list while you're expecting, then there's a very good chance that you'll be able to get childcare.
And I guess community-wise, is there also a very heavy demand and kind of a limited ability to accommodate? I'm just wondering, how do we select? Is there any
How do you prioritize? the
mechanism?
community?
Yeah, exactly. How do you prioritize who will and who won't be, selected for the program?
I know for the 51 spots, the daycare always prioritizes Bellevue, but beyond that, I don't have information on how they handle the remaining spots for the community.
I mean, another point to add in is, there's it's limited by age group, so there are very limited windows when you can fill a seat and when someone is the right age group.
Is the 51% only for the infant and toddlers? Is that, and is there any consideration of changing that for the older kids, or?
So the enrollment for 3K and pre-K is done through the city. It's all through one application through the city's website. So the daycare has reached out and tried to get a little control over that, but the city manages that wait list, and so far,
Oh, so we can't impose the 51% minimum on that?
Right, so
Exactly.
it's Department of Education manages the wait list.
Okay.
That is correct.
I just had one question on the contract, on the arrangement. So I think I know we've waived the occupancy fee, but if there is repairs necessary or maintenance or that kind of thing, is that our cost, or does the daycare pay for that?
that's the daycare's responsibility. For example, this expansion over here was funded by grant,
Oh.
and they're responsible for their space, and any kind of renovation that they would want to do.
Okay, and then just and security and cleaning and maintenance, is that, they pay for that as well? Or?
Cleaning they handle, yes.
Oh, okay, great, thank you.
Okay, any other questions or? Hearing none, let's take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you so much. So let me move on to 16 and 17, which will be one presentation. And it's authorizing New York City Health and Hospitals Corporation to execute a renewal lease with LSS Leasing Limited Liability Company, the landlord, for approximately 5,120 square feet on the ground floor at 5917 Junction Boulevard, Corona, New York. The premises to house the Women's Medical Center operated by NYC Health and Hospitals Gotham Health for an initial term of 15 years, with the system holding 2 5-year options to extend the lease at an initial $50 per square feet, to increase annually at 3% for an initial annual rent of $320,000 and a total rent over the potential term of 25 years of $11,666,965. And this was presented to the Capital Committee on November 4th, 2024. And number 17, authorizing New York City Health and Hospitals Corporation, the system, to execute a renewal sublease with Pediatric Specialties of Queens, PC, for approximately 2,457 square feet on the ground floor at 5917 Junction Boulevard in Corona, New York, the premises in which the PC will continue to operate a pediatric medicine practice co-located with the Women's Medical Center, operated by NYC Health and Hospitals Gotham Health, for an initial term of 7.5 years at an initial rent of $64 per square feet, to increase annually at 3% for an initial annual rent of $157,248, provided the PC shall have an option to extend the term of the sublease by another 7.5 years, and provided further, the system shall hold an option to take back up to 25% of the area subleased to the PC on 1 year's prior notice, and with a corresponding reduction in the sublease rent payable by the PC, with the total sublease rent over the maximum potential 15-year term of $2,924,642. And this was also presented to the Capital Committee on November 4th, 2024.
Thank you. So what I wanted to do today is talk a little bit about our clinic talk a little bit about Gotham Health and our footprint in Queens, and then talk about the individual health needs of this community that we know and the important role that our clinic serves for this community. For the clinic itself, by way of background, we occupy a little bit over 5,000 square feet in the larger commercial building. It's near the R&M subway lines, and importantly, we've been here since the year 2000. So we've been providing care in a reliable and trusted way in this community for over 20 years. This clinic joined Gotham Health in October of 2018. What's special about this clinic is that we predominantly provide women's health care and women's primary care services. Examples of this are our comprehensive annual exams, breast and cervical cancer screenings, perimenopausal and postmenopausal care, sexually transmitted infection care, and importantly, prenatal care. If I go to the next slide, we can see here that we provide this care in a continuum with another practice that also is co-located on the first floor of this building. So for the past over 20 years, there's been a pediatric practice that has been our tenant or with a sublease on the first floor of the building where we have our LaFrat clinic. The way it works is we see expectant mothers, we deliver excellent medical care to them, and then when they deliver and they have a healthy child born, ideally one of our hospitals, this clinic is where a lot of the mothers choose to bring their children for pediatric care. So it represents a continuum that exists, it works, and people choose to use it day by day, year by year. Let's go to the next slide here. Zooming out for a second, just as a reminder, here's how where we currently have our 8 Gotham Health clinics in Queens. And you can see here circled is the clinic we're talking about today. We'll go to the next slide. Changing gears, I wanted to talk a little bit about, as I said, the unique health needs that we know about in this community. So in Elmhurst and Corona, the rate of expectant mothers receiving late or no prenatal care is higher than the citywide rate. That just shows the importance of having these specific services that we offer in this clinic, because we already are seeing that the rate of late or no prenatal care is higher than it should be. On the pediatric care side, 1 out of every 4 children in grades K to 8 has obesity, which is also higher than the citywide average. Again, thinking back to that continuum of care, we want to provide care to expectant mothers, but then we want to make sure that they can transition the care for their kids into an excellent pediatric practice. And we see here that we have more work to do to make sure that we're keeping kids healthy in this community. In Elmhurst and Queens, also the teen birth rate is 25.8, which is higher than the citywide rate. Also speaking to the need for women's health that we provide in that clinic as well. And then finally, in Elmhurst and Corona, 33% of adults are uninsured, which is higher than the rest of New York City. Taken another way, we also know that in Elmhurst and Corona, residents rank their health as excellent only 68% of the time, which is lower than the citywide goal of 82%. So again, to summarize, the women's health services that we provide here are critical. We see a continued need in this community for the exact services we provide every day in this clinic. And people trust us in this clinic and choose to send their kids to the pediatric practice right down the hallway from us through the shared entrance we have. Next slide here just goes into a little bit more detail about the clinic itself in terms of some numbers. 96% of our patients are women. That's across nearly 1,600 patients, and we're completing over 3,800 visits a year, predominantly for our women patients.
So these are the prime lease terms. Gotham LaFrat will continue to occupy approximately 52% of a 5,120 square foot space located within a mixed-use building located at 5917 Junction Boulevard, Queens. And the other portion will continue to be occupied by subtenant Pediatric Specialties of Queens. The term is 15 years with 2 5-year options for renewal and will commence upon execution. The base rent is $62.50 a square foot to escalate 3% each year for 15 years. The first year's rent will be $320,000, which is $26,666.70 a month. Gotham is responsible for operating expenses, including water, electricity, and maintenance. As part of this renewal, the landlord will replace the HVAC system and make improvements to the building entry system at their cost. Any increases in property tax are billed as additional rent. The last 2 years' increase was 0. The total occupancy fee for base rent over the potential 25 years will be approximately $11,666,965. Now we'll talk about the Pediatric Specialties of Queens, the subtenant.
So this subtenant is led by Dr. Villegas, who is a doctor that was trained in our system at Elmhurst Hospital and is part of the MetroPlus network of providers. So again, the continuum that we've built and has evolved over time is, again, one of our own, Dr. Villegas, who is trained at one of our hospitals, is providing pediatric care much of the time to the children born to the mothers that we deliver excellent care at the LaFrat Clinic to as part of their prenatal care for expectant mothers. So that relationship has continued to evolve, to strengthen. their practice has been a good subtenant, but I think the most important thing to say is, again, that continuum of care where people know to go for the care that they trust, so that they can continue to come there once their kids are born, has been very important, and people have voted with their feet, and year by year, more and more are doing that.
This is the space they share. The pediatric specialties, the subtenant is in blue. Gotham and the subtenant share a building entry system as well as a small administrative and record-keeping space. These are the terms of the sublease. Pediatric Specialty of Queens will continue to occupy about 48% of the total 5,120 square feet total lease, or about 2,457 square feet. The lease term is a 7.5-year sublease with one option for 7.5-year renewal. The base rent is fair market value, $64 a square foot to escalate 3% each year for 7.5 years. First year's rent will be $157,248 or $13,104 a month. Gotham will have the option with 12 months notice to recapture up to 25% of the sublease space. The subtenant is responsible for 48% of other occupancy costs such as electrical usage and maintenance, and 48% of increases in property tax will be billed as additional rent, making a total potential source of revenue of up to $2,924,642. And now there are two resolutions for your approval.
Thank you. Go ahead, Dr. Calamia. Dr. Calamia?
Yeah, just a question relating to the pediatric group and
Yeah.
insurances. I know they accept Medicaid, but what happens with the uninsured, particularly undocumented? What are they accepted at all, or how is that handled?
It's a good question. I mean, of course, it's that practice's choice what they would accept. But we have a good relationship with them, and we refer patients to them all the time. And it's good that they're within our MetroPlus network. We haven't heard issues with patients that wanted to go there not being able to, but I think that's something important to keep an eye on because these are our patients when they start in our clinic.
Any other questions? Okay, so let me call the vote on this one. All in favor of approving a renewal lease to LSS Leasing Limited Liability Company to house a women's medical Goddard Center and a sublease to Pediatric Specialties of Queens PC to operate a pediatric medicine practice collaborating with the Gotham Center at the same address. All in favor, please say yes.
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 Opposed, say no. So the resolution approved. Thank you so much.
Thank you.
Let me move to number 18. Authorizing the New York City Health and Hospitals Corporation, the system, to sign a 10-year lease with ACE 3003 Avenue LLC. I'm sorry, it's ACE 3003 Avenue LLC for approximately 1,200 square feet of ground floor space at 1902 Flatbush Avenue, Brooklyn, to operate a supplemental food program for women, infants, and children, managed by NYC Health and Hospitals South Brooklyn Health, at a rent of $54,000 per year or $45 per square feet, to be escalated by 2.5% per year. That is payable only after 2 months at no rent, with an option to terminate after 5 years. Exercisable only by the system if the WIC program funding is discontinued, provided the system makes a termination payment of 3 months' rent on termination, and with a further option held by the system to renew the lease for an additional 5 years for a total rent of $968,324 due over the potential 15-year term. And this was presented to the Capital Committee on November 4th, 2024.
Great, thank you. So the Women, Infant, Children Program provides nutrition services to pregnant, breastfeeding, and postpartum women, infant, and children less than 5 years of age. New York State Department of Health awarded a WIC program to South Brooklyn Hospital for service within the zip code 11210, which serves about approximately 2,210 patients through this grant. South Brooklyn currently operates this WIC at another location and is proposing to move to this new space. The New York State Department of Health has approved use of this site for the WIC program. Next slide. These are the lease terms. New York City Health and Hospital South Brooklyn Health will occupy 1,200 square feet at 1902 Flatbush Avenue, Brooklyn. A 10-year lease term will commence upon execution of the lease with one 5-year option. The base rent is $45 a square foot to escalate 2.5% per year. The system will get 2 months of the lease term rent-free. The system will hold an option to terminate the lease at the end of the 5th year if the DOH WIC grant program is not continued. To exercise such termination option, the system shall pay a termination fee equal to 3 months' rent. As a condition of occupancy, the landlord will provide an ADA accessible restroom and other minor improvements that are required. The total annual occupancy fee for base rent over the potential 15-year term will be approximately $959,000, $324. Please let us know if you have any questions.
So just one thing to add, Svetlana Lipanska for South Brooklyn Health. As discussed in the Capital Committee, we would like to co-locate some medical services in this location. We actually got the landlord to do the work necessary, so they will be building out 2 exam rooms. So in addition to running the WIC program, we'll be able to serve the medical needs of the women who are receiving WIC benefits in that area.
Any questions from board members? Hearing none, let's take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So the resolution approved. Thank you so much.
Thank you very much.
Let me move to number 19, authorizing New York City Health and Hospitals Corporation, the system, to further increase the funding by $8 million for its previously executed agreement with Array Architects, Inc. for architectural and engineering services for the renovation of spaces at NYC Health and Hospitals Bellevue Hospital and NYC H&H Woodhull Hospital that began in June 2020 in connection with the system's Correctional Health Services initiative to treat its patients who require higher levels of care in its outposted therapeutic housing units, which follows previous funding increases of $1,814,880 authorized in November 2021 and $6,409,289 in November 2022, $1,960,238 in May 2023, $3,477,599 in November 2023, such that the funding is increased from $22,325,006 to a total not to exceed the sum of $30,325,006, and to extend the contract by 3 years to November 30th, 2028, with anticipated construction completion of December 2027, and this was presented to a Capital Committee on November 4th.
Good afternoon, board members. I'm Manny Sayas from the Office of Facilities Development. Dr. Katz and Dr. Pagan. I'm joined here with Oscar Gonzalez and Menji Endorf, also from OFD, and Tim O'Leary, one of our leaders from Correctional Health, and also Patsy Yang, Senior Vice President from Correctional Health. I'll hand it over to Oscar to work us through the presentation.
Good afternoon. So yes, back in 2020, we executed an agreement with Array Architects to be able to design OTXHU, outposted therapeutic housing units, both at Bellevue and Woodhull. We proceeded with the work. We've come back for several different amendments. We put the Woodhull portion on pause at 90% of the design, but we proceeded with the work at Bellevue, and we also proceeded with the procurement and construction as well. So now that project is wrapping up, but we've been allowed to proceed ahead with Woodhull, and that's where Tim is going to give you a little bit of the background there. Next slide.
On March 4th, the mayor directed Health and Hospitals to move forward with construction of the outposted units at Woodhull and NCB. Restacking of Woodhull's 9th and 10th floors has been completed. The second phase of Woodhull OTXA2, which is the roof replacement, will be completed by March 2025, which is necessary to support the recreation deck. New requirements for security operations necessitate a 90% redesign of the 9th and 10th floor, which is where the housing units are, in order to incorporate security redesigns that were put into and approved in Bellevue. Funding for these new requirements have been provided. Funding for these new requirements have been provided by OMB in the September capital plan, and construction of the Woodhull OTXHU is anticipated to begin in fall of 2025 and be completed by December 2027.
So this specific request is for authorization to increase in the amount of $8 million to Array Architects to bring us to a not to exceed value of $30,325,000 and extend the contract by 3 years from November 2025 to November 2028. The vendor has been performing very well. The funding, as Tim said, has been provided by OMB, and the CP is being prepared to be submitted to OMB. And then, last but not least, the utilization plan. The original goal was set for 36.71%, and to date, we are at 37.37%. And as I mentioned, the vendor is doing really, really well. And with that, we will take some questions.
Any questions from board members? Yeah.
I know we've had, various redesigns and had different security requirements and things like that that have precipitated a need to go back and maybe redo some of the plans that had originally been done, and that's driven some of these increases that we've had. I think you guys did a nice job laying out all the different increases and the reasons why. One of the things we talked about with a lot of the starts and stops at Bellevue was to try to garner some lessons learned so that maybe we didn't have that same thing happening at Woodhull. Is this a similar thing, or it's just that we are having we haven't had time to work on Woodhull, and so this is the new cost that's arising, or have we had to go back and redesign and do work that we'd already done before? Do that?
So we did have to put a pause on the project at Woodhull. So we did get to a certain point in design. We did grab those lessons learned. We're incorporating them now. But it is also a different facility, has different requirements, is a lot of the expectations from the end user. It's really at that location, right? We cannot, Bellevue and Woodhull, two completely different facilities. So at the end of the day, we're going to need that regulatory sign off from them because they're going to be the ones using it.
Yeah, so I think the core of the essential elements of what we learned and had to adapt or change for the Bellevue design were incorporated, are being incorporated in Woodhull and NCB. But as Oscar said, because each facility and the footprint is so different, there are some additional changes and characteristics that the Department of Correction has requested.
Okay.
So they will be facility specific, although the core elements, the principles and the approach have been carried over.
Right. So some of it is also maybe in managing the contract at what's the right time. Like, so Oscar, you said you put a pause, and so you're not spending money designing in one direction and then finding out that, oh, this doesn't work at Woodhull and we have to change and go in another direction.
I think this is a momentous project. I mean, in a number of ways, but in terms of construction and the capital, the work itself is kudos to OFD and the system. This is the biggest, I think, the biggest.
It's the largest that we're
the largest that
self-managing
they've ever done and
internally.
self-managed. So they really took on a bit of a bear.
You picked an easy one to be the
Yeah,
first,
yeah.
right?
And so far have managed to really minimize the risk of having to undo things. So.
So hopefully that is going to continue to improve because we have NCB to do next too as well. So, not to remind you of the big task ahead, but yeah, great. Thank you.
Thank you.
Anything else on this one? So let's take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. So resolution approved. Thank you so much. Let me move to number 20 in your agenda. Authorizing the New York City Health and Hospitals Corporation to execute a contract with Myco Cooling Corporation to undertake essential preventive maintenance and repair services of refrigeration and related cooling equipment for a contract amount of $6,668,810 with a 20% project contingency of $1,333,762 and an emergency repairs allowance of $666,881 to bring the total cost not to exceed $8,669,454. This was presented to the Capital Committee November 4th, 2024.
Thank you. Good afternoon once again. So refrigerators, freezers, ACs, and ice machines are an essential component to adhere to all refrigeration and HVAC adherence in our facilities. We currently have a refrigeration and maintenance contract with Myco Cooling that is due to expire in January 2025. The contract includes PM labor and emergency repair with an annual spend of $1.2 million. Full-time PMs and repairs will commence at Queens, Lincoln, Harlem and Bellevue for a contracted amount of $948,000, and emergency repairs throughout the system for a little over $262,000. The vendor will assume preventative maintenance responsibilities for all equipment at all 4 sites, and the vendor will provide refrigeration repair as needed throughout the system. And with that, I hand it over to Menji to take us through the procurement.
Thank you. This is our standard minimum criteria, standard substantive criteria for RFPs. The evaluation committee was made up of a number of DOEs and senior stationary engineers from our sites. Next slide. Overview of the procurement. Back in August of 23, the application to issue proposals was approved by CRC. It was posted to City Record in June of 24. 4 vendors received the solicitation. 6 vendors attended the pre-proposal conference. Vendor walkthroughs were conducted in July. 2 proposals were received, and the evaluation committee scored those proposals, and MICO was the top scoring proposer in August of this year. Next slide. This is the vendor performance, which is excellent to date. Next slide. So this is the contract budget. Base contract $6.6 million with a contingency for emergency repairs and new installs for a total contract value of not to exceed of $8.6 million. Next slide. So MICO is a certified WBE. The base contract amount is $6.6 million. The contract will start in January of 2025 for a base term of 3 years with 2 one-year options, solely exercisable at the discretion of the system. Thank you. Happy to take any questions. Yes.
So it's a fairly significant increase from the prior contract, and in terms of percentage increase, are we covering the same locations, or is it, has that grown, or is it just, that's just inflation?
Cost of doing business, but also I think the emergency repairs and the contingency, because our equipment has continued to age, is a little bit higher than it was in the previous contract. I think the last contract it was 10%. This one is 20%.
Right, but just the base cost
Base has gone, yeah.
has
that's-
gone up
yeah,
by
yeah.
over 20%, I think, so, but, so we are doing, it's the same facilities as before?
Same facility, same scope, yeah. That
All
hasn't
They call for that level of demand at those sites.
Okay, thank you.
Further questions, or? Let's take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. So there are like 2 more presentations, so bear with me.
What's that?
There we 2 more presentations, 2 more. So I'm gonna read 21, 23 together, all together. So 21 is amended, when it was amended to revise terms to commence April 2025 to March 2028 instead of February 2025 to January 2028. And the resolution is authorizing the New York City Health and Hospitals Corporation to execute a contract with Carrier Corporation to provide HVAC, chiller, preventative maintenance and repair services at several acute care hospitals for 3 years with 2 one-year renewal options for a contract amount of $1,869,290 with a 20% project contingency of $373,858 to bring the total cost not to exceed to $2,243,147. This was presented to the Capital Committee on November 4th, 2024. The next one is amending same amendment to revise terms to commence April 2025 to March 2028 instead of February 2025 to January 2028, and the resolution is authorizing the New York City Health and Hospitals Corporation to execute a contract with Johnson Controls, Inc. to provide HVAC, chiller, preventive maintenance and repair services at several acute care hospitals for 3 years with 2 one-year renewal options for a contract amount of $4,626,212 with a 20% project contingency of $925,242 to bring the total cost not to exceed to $5,551,454. Again, presented at the Capital Committee November 4th. And the last one, amended to revise terms to commence April 2025 to March 2028 instead of February 2025 to January 2028. And the resolution is authorizing the New York City Health and Hospitals Corporation to execute a contract with Train US Inc. to provide HVAC, chiller, preventative maintenance and repair services at several acute care hospitals for 3 years with 2 one-year renewal options for a contract amount of $1,523,691 with a 20% project contingency of $304,738 to bring the total cost not to exceed to $1,828,429. Again, presented at the Capital Committee earlier this month.
Thank you, Dr. Pagan. Chillers are a major component of our cooling systems in our systems, in our HVAC systems. The system currently has 110 chillers in our inventory. We currently have a contract with Carrier that is a 5-year term that is set to that has expired in October of 2024. The contract spent for maintenance services over the past 5 years has been $5 million. A 5-month best interest extension has been applied to expect the spend to be roughly around $739,000 and has been executed in the RFP process and internal approvals set to expire in March of 2025, allowing us to do this procurement. The system has a single vendor and it has had one for the last few years. Due to the nature and the complexity of these systems, it's been very challenging for us to get the service, the parts, and the timeliness of response that we need in a lot of our systems. So we have elected to, in order to best service our systems, we want to have the OEM manufacturer manage the preventative maintenance programs and repairs for each of our components, which would be grouped. And the way we have it listed out here is groups 1 through 5. So the OEMs for the different manufacturers is where we would want the services to be provided in order to better serve our systems and keep our systems running efficiently. Over the summer, we had extensive heat waves, and it was very challenging, as it is for the rest of the city, when there's this kind of demand for service providers to be efficient. So this is how we'd like to go with that, and Menji will take us through the procurement.
Thank you, Manny. So back in July of '23, the original RFP was approved by CRC for posting. It was amended to adjust the equipment into the equipment groups that we created, the 5 equipment groups, and it was reposted on July of '24 and sent directly to 12 vendors. There was a pre-proposal conference held in July. 9 vendors attended. 5 proposals were received, and the proposers for each equipment group that was awarded, you can see listed Carrier got Group 1, Johnson Controls Group 2, Trane Group 3, and Johnson Controls Group 4 and 5. Next slide. This is our standard procurement, minimum criteria, substantive criteria. Again, the evaluation committee was made up of a number of our chief engineers and DOEs from our sites. Next slide. This shows the first group of equipment, which is Carrier as the OEM. Carrier was the vendor selected for a contract not to exceed $2.2 million. Next slide. This is equipment group 2, 4, and 5. Johnson Control and York Equipment. They're the OEM manufacturer, and they also got the group 5, which is kind of a hodgepodge of various OEMs together for a not to exceed contract of $5.5 million. And then the last group, Group 3, was Trane as the OEM manufacturer, so they were the vendors selected for a total not to exceed of $1.8 million. Next slide. So the contract will start in April of 2025. It'll have 3 base years with 2 one-year extensions. Carrier is the current incumbent. They have a good rating. JCI, we have a BMS contract with them, and we've used them in the past for HVAC repairs as well, and they have a good rating. Trane has also done work on their system, and they have an excellent rating. All 3 vendors requested MWBE waivers. Trane and Carrier requested a 30% waiver because they're the OEM manufacturer. They're self-performing the work, and they manufacture most of the parts for the equipment as well. So there wasn't a tremendous opportunity for them to subcontract or purchase parts outside of their company. JCI requested a 20% waiver because of Group 5, the non-JCI OEM equipment. There's an opportunity to sub that work out and also purchase parts outside of JCI. So the vendor diversity team identified a 10% opportunity there. Next slide. These are the vendor performance ratings. Carrier is good, JCI is good, and Trane, as you mentioned, is excellent. And the last slide here shows you the contract budgets. $2.2 million for Carrier, JCI $5.5 million, and Trane $1.8 million. And the last slide is the approval request, and happy to take any questions.
Any questions on this one? These 3? Okay. So I'm going to call it for a vote. Then all in favor of approving contracts for Carrier Corporation, Johnson Controls Inc., and Trane US Inc. to provide HVAC chiller preventive maintenance and repair services at several acute care hospitals. All in favor, please say yes. Yes. Opposed, say no. So the 3 resolutions approved. Let me move then to 24 and 25 is the last presentation. So authorizing the New York City Health and Hospitals Corporation to increase the funding by $5 million to its previously negotiated and executed requirements contracts with 7 architectural and engineering consultant firms, namely Architectural Preservation Studio, DCP, H2M Architects, Engineers, Land Surveying and Landscape Architecture, DPC, Hoffman Architects and Engineering of New York, DPC, Lothrop Associates Architects, DPC, Ronette Riley Architects, Superstructures of Engineering and Architecture, PLLC, Urban Architects, PLLC, to provide professional AI design services related to exterior envelope projects on an as-needed basis at various facilities throughout the corporation. The cumulative not-to-exceed value for services provided by all such consultants shall increase from $10 million to $15 million, and this was presented to the Capital Committee on November 4th, 2024. And number 25 in your agenda is authorizing New York City Health and Hospitals Corporation to execute requirements contracts with eight architectural engineering consultant firms, namely Architectural Preservation Studio, DCP, H2M Architects, Engineers, Land Surveying and Landscape Architecture, Hoffman Architects and Engineers of New York, DPC, Lyro Architects and Planners, PC, Lothrop Associates Architects, DPC, Superstructures Engineering and Architecture, PLLC, Thornton Tomasetti and Urban Architects, PLLC, to provide professional AI design services related to exterior envelope projects on an as-needed basis at various facilities throughout the system, to commence on January 1st, 2026, for an initial term of 3 years with 2 one-year renewal options. The cumulative not-to-exceed value of services provided by all such consultants should not exceed $20 million. And that this was presented also to the Capital Committee November 4th.
Thank you. The Office of Facilities Development is seeking to increase the funding to our current projects, to our current contractors for architectural and engineering services throughout our system. The work would include projects involving major and minor rehabilitation efforts, facade projects, roofing and roofing-related repairs, window assemblies, interior spaces, local law 11 compliance. The current pool is made up of 7 firms, all listed here, as previously mentioned in the resolution. Current pool NTE is $10 million. $8.7 million is committed to date, accumulating to 88%. OFD seeks to extend the existing contracts for a year pursuant to the contract and increase by the NTE of $5 million. OFD also seeks to procure the services and replacement consultants whose contracts will go into effect once the pool consultant's extension expires. And Medju will walk us through the current state.
Okay, so this just shows the current NTE with the work orders we've issued for 8.8 million, remaining balance of 1.1 million for the current pool through 2025. We have an additional option here that we'd like to exercise, and based on the capital portfolio work that we have scheduled for next calendar year, along with some additional work we have coming your way, we anticipate needing an additional $5 million, hence the request for the 5 million NTE increase for next year. That, I'll pause here because that is just the current pool, and I'll see if anyone has any questions related to this request.
Any questions?
So that means the funding for the 5 million, some will come from our own funds and some will come from city capital? Is that the-
Correct.
Okay. So you already have identified uses for this contract? Basically.
Correct. We have the capital plan, so we have projects scheduled for delivery next year that we
So
know.
this isn't like our requirements contract where we just have them there and we use them for different.
We do have some expense spends that things arise. You know, we have local law 11 work that as we go through the cycle surveys, there may be needs for their services that we use through expense, but the capital work is identified and we know exactly what we have scheduled unless we have emergencies, in which
And
case.
that's what the 5 million is for?
5 million is a mix of both, expense and capital.
Okay, thank you.
Yeah.
Okay. Working through the procurement for the new contracts.
Okay. Quickly, so the overview of the procurement. This application to issue the RFP was issued in December of 2023. The RFP was posted in City Record and sent to 7 vendors. 47 vendors attended the pre-proposal conference. 27 proposals were received. There were 2 rounds of scorings. On the second round, 4 vendors were invited to present, and the evaluation committee selected H2M, Thornton Tomasetti, APS, Lero Architects, Hoffman Architects, Urban Architects, Lothrop Associates Architects, and Superstructures as the highest proposers. The next slide. This is our standard minimum criteria, substantive criteria. The evaluation committee were made up of a number of OFD team members, director of capital at a number of the sites, and AEDs from sites as well. Next slide. We're seeking to enter into a contract for exterior envelope services with the 8 vendors I previously mentioned. The vendors that have asterisks next to their name are incumbents in the current pool, and they will have received new contracts in January of 26. All non-MWB vendors have committed to a 30%, at least a 30% goal, some greater, and the anticipated start date is January 1st, 2026, for a not to exceed amount of $20 million over the total 5-year term of the contract. Next slide. This summarizes the vendor performance and their previous MWB if they were in the pool, and their current MWB goals if they're being awarded a new contract.
Next MPU, is it 26 or 25?
26, January 1st, 2026.
Until next year.
Correct. Yeah.
Or next year.
Next year. Correct. Sorry. Next year. You're right. Yes. We're so close to 2025. Yes. These are the vendor performance slides. APS is excellent. H2M is good. Hoffman is fair. Lothrop is good. Lero is excellent. Superstructures is good. Renette Riley is fair. Thornton Tomasetti is excellent, and Urban is excellent. These are the vendor diversity goals that were set for each vendor. They're all, as mentioned, at least 30%. And the last slide is the request for approval. Thank you, and happy to take any questions.
Any questions? These 2 resolutions? Okay, so let me then call them for a vote. The first one is all in favor of authorizing an increase in funding of $5 million to the previously negotiated and executed requirements pool of 7 contracts for architectural and engineering consultant firms as indicated in the resolution of presentation. All in favor, please say yes.
Yes.
Opposed, say no. Okay, and the next one is all in favor of approving requirements contracts with 8 architectural and engineering consultant firms to commence in January 1st, 2026, as indicated in the resolution and presentation. All in favor, please say yes.
Yes.
Say no. So the 2 resolutions approved. Thank you so much
Thank you.
for doing it. Looks like you are very busy. Next we move to the President's report. Dr.
Yes,
Katz.
we celebrated International Kindness Day. You've seen some of our posters, and we're doing a general effort to increase people's focus on kindness and remembering that a lot of healthcare is experienced in terms of how people respond to others in a vulnerable position. We think it's really important. We celebrated Veterans Day by partnering with the New York City Department of Veterans Services to make sure that people were aware of our services for veterans. We continue to use low-dose CT scans to identify people who have lung cancer at a time when it is curable through surgery. We had several of our leaders at hospitals recognized as 2024 notable leaders in healthcare, including Nicole Jordan Martin and Svetlana Lipskaya and Talia Schwartz. Amanda Johnson, who many of you know, got the 40 under 40 designation. I'm still waiting for the 60 over 60, but I may have to wait a while for that. But we were very proud of her. Our long-term care and short-term rehab units were ranked at the very top on the U.S. News and World Report. Metropolitan Hospital, our most loving hospital, received an A grade from independent Leapfrog. For the 11th consecutive year, our ACO garnered shared savings. In this case, $6.1 million. Queens launched a new weight management program. Something I thought was really special, we opened up a Ronald McDonald room at Metropolitan. And what made it special, and I didn't myself know the full history, Ronald McDonald created the houses for children and their families having cancer treatment at places like Sloan Kettering, where the family was coming from far away and needed a place, safe place. And that's a wonderful mission. But they have now also recognized there are children in New York City, and they and their families need support. And that all of that isn't only on inpatients. So we already have at King's and Jacobi Ronald McDonald rooms for families, for children who are hospitalized, which often have things like washer dryers so people can keep their clothes clean and places to rest and food. But this is their first ever completely outpatient program because Met has a very, very small inpatient pediatric practice and a huge outpatient practice. And the children and families have a lot of needs. So I thought it was really great that the Garden of Dreams, which is the nonprofit arm of Madison Square Garden, and Ronald McDonald came together to produce this room, and it's beautiful. Next time any of you are at Met, just go by and see how nice it is. Bellevue graduated its 50th class of radiology technology people. We continue, I think, to do amazing work for asylum seekers. The overall census has reduced. We're currently at about 23,000 guests. Some of that reduction is because Dr. Ted Long and Chris and his team have done such an amazing job creating case management services to help people figure out a long-term plan, and that's helped many people to find its next step. So with that, I'm happy to answer any questions that you may have or hear any suggestions.
Any questions or comments?
An amazing job. We're down to 23. That's pretty good.
Anything else? Okay. I think
All
I
right.
managed to have a busy meeting today, so. Anyway,
A lot of resolutions.
The committee, yeah.
A lot of resolutions.
The committee reports were emailed to you and are in your electronic folders for your review and submission into the record. Are there any questions or comments about those reports? Is there any old or new business from board members to come before this board? Hearing none, the meeting is adjourned. Thank you.
This meeting is no longer being recorded.